How to properly clean your foreskin. Maintaining proper hygiene for the foreskin is crucial for preventing infections, irritation, and the buildup of bacteria. Here's an expert guide to ensure you're taking the best care of this sensitive area. Why is cleaning your foreskin important? The genital area is prone to moisture, sweat, and natural secretions, creating an environment that can foster balanitis, inflammation of the glands, fungal or bacterial infections, unpleasant odors, and chronic irritation. Regular cleaning also helps you identify any abnormalities, such as lumps, lesions, or signs of infection at an early stage. Step-by-step guide to cleaning your foreskin. 1. Choose gentle products. Use a mild, fragrance-free soap such as Dove Sensitive Skin or Cetaphil Gentle Cleanser, which are less likely to irritate the delicate skin. 2. Retract the foreskin gently. Slide the foreskin back carefully. If you cannot fully retract it, do not force it. Persistent difficulty may indicate a condition like phimosis, which requires medical attention. 3. Clean the glands and inner foreskin. Wash the exposed glands and the inner side of the foreskin with warm water and a small amount of soap. Use your hands to gently rub the area. Avoid scrubbing or using rough materials. 4. Rinse thoroughly. Make sure to remove all soap residue, as leftover soap can cause dryness or irritation. 5. Dry completely. Use a soft, clean towel to pat the area dry. Pay extra attention to the area under the foreskin to prevent moisture buildup, which can lead to fungal infections. Recommended products and techniques: hypoallergenic soaps. These reduce the risk of irritation. Examples include Vanicream Gentle Body Wash. Warm saline baths. A warm saltwater solution can help soothe minor irritations or inflammation. Chamomile washes. This natural option can reduce irritation and inflammation if you experience mild discomfort. Hypoallergenic wipes. In emergencies, products like water wipes can provide a quick clean but should not replace a full wash. Additional hygiene tips. Trim pubic hair regularly, reduces sweat and bacteria buildup. Wear breathable underwear. Opt for cotton fabrics to keep the area dry and fresh. Shower after physical activities. Wash your genitals promptly after sweating to avoid bacterial growth. Avoid fragrance products. Stay away from sprays, powders, or soaps with added perfumes that could irritate the sensitive skin. Frequently asked questions. 1. What if I can't retract my foreskin? Consult a healthcare provider. You may have phimosis, a condition where the foreskin cannot be fully retracted. 2. Is smegma normal? Yes, smegma is a natural secretion, but it needs to be cleaned daily to avoid odor, discomfort, and infections. 3. Can I use antibacterial soap? Only if recommended by a doctor. These soaps can disrupt the skin's natural balance. 4. What should I do if I experience irritation after cleaning? Switch to washing with just warm water and avoid using soap until the irritation subsides. Seek medical advice if it persists. Taking a few minutes daily to clean your foreskin ensures hygiene and helps prevent complications. With these tips and proper techniques, you'll maintain a clean and healthy genital area. If you found this guide helpful, give this video a like, subscribe to Prostate Patrol, and hit the notification bell *** for more essential male health tips. See you in the next video.